This webinar was originally presented by the Tobacco Control Legal Consortium, a program of the Public Health Law Center in St. Paul, Minnesota.
Hello everyone, and welcome to today's webinar. You'll have to wait a little bit longer. Practical support and policy considerations for Tobacco 21 laws. Today's webinar is a presentation of the Tobacco Control Legal Consortium, a program of the Public Health Law Center. Founded in 2000, the Public Health Law Center is a national nonprofit law and policy organization that helps health leaders, officials, and advocates use the law to advance public health. Our center is located at Mitchell-Hamlin School of Law in St. Paul, Minnesota. My name is Scott Kelly, and I will be today's moderator. I'm an attorney who works on tobacco control initiatives primarily in the state of Minnesota. Joining me today is Beverly May. Ms. May is a Regional Advocacy Director for the Western States and National Project Manager for Raising the Tobacco Age to 21. Beverly provides support and technical assistance to state tobacco control coalitions and programs as they advocate for tobacco control policies and implement comprehensive prevention and cessation programs. She provides testimony in state legislation on a variety of tobacco control issues, as well as speaks at local and national conferences and other public forums. Also, she provided technical assistance and training for the country of India's smoke-free law. Beverly has more than 20 years experience working in the area of policy change, focusing in anti-tobacco issues. She has 30 years of experience with youth, focusing on behavior and substance abuse issues. She has a Bachelor of Science degree in Community Health Education and Master's in Public Administration from the University of Utah. We welcome Beverly. We are also joined today by Carrie Snyder. Ms. Snyder is the Assistant Director for the Public Health and Tobacco Policy Center in Boston, Massachusetts. The Public Health and Tobacco Policy Center is a resource for communities striving to improve public health through implementing evidence-based policies. The center provides legal and technical support for policies that reduce the availability of and market for tobacco products, to reduce unwanted exposure to secondhand smoke, to minimize tobacco advertising and promotion, to increase cancer screening rates, and to promote healthy behaviors. Prior to joining the center, Carrie served as an associate counsel with the New Jersey Office of Legislative Services, where she provided legal advice and drafted legislation for the members of the New Jersey legislature. Her previous experience includes working as an associate with the law firm of Sidney & Gold, and as the Legislative Director and Chief of Staff in the Office of Massachusetts State Senator Stephen Tolman. Carrie received her J.D. cum laude from Suffolk University Law School with a Certificate of Concentration in Health and Biomedical Law, and she was a founding member of the Journal of Health and Biomedical Law. From Newton, Massachusetts in the east to California and Hawaii out west, Tobacco 21 laws have washed across the country like a tidal wave. There is tremendous interest in raising the minimum legal sale age both at the state level and at the local level as well. 150 so local communities and nearly a dozen states have already done so. You know, there's so much interest in policies being passed, it's hard to use a map or other list without some fear that it's already incomplete or somewhat outdated. But even with all this momentum, there are still many places, many folks working in tobacco control that are thinking about Tobacco 21 laws and have some of these basic questions. Why? Why is raising the age so important? Or how? How do we do it in our state or in our city? And the what? If we are working on Tobacco 21 or T21 laws, what else do we really need to be thinking about at the same time? So for the next hour or so, we're going to dive into the what, the where, and the how of these issues. The rationale and messaging when working to adopt T21 laws in your communities, the different policy or implementation approaches that are available, the critical role of compliance and enforcement when laws are adopted, and other legal considerations and possible challenges that can and do arise. And as Cam mentioned earlier, there will be time for your questions. So with no further ado, it's my pleasure to turn it over to Beverly. Beverly?
Hello, everyone. Scott, thank you for asking me to present today. I want to talk about this emerging policy strategy that has come about. it's one of these issues. I've been around long enough to remember smoke-free laws, and there's a lot of similarities, but as I go on speaking about this, I want you to imagine that we don't just change that 18 to 21. There's a lot more goes into it, and we're learning all the time as we move forward. As we started with the Big Island of Hawaii a number of years ago, worked on, and then as we've moved forward to California. So I will try to answer some of these questions for you today. And why raise the age? Why would we even consider doing this? Well, first of all, 95% of adult smokers begin smoking before they turn 21. I think if you look at the bottom of the slide, it's kind of dated 1986, but this is another reason we certainly would want to move forward. This is from the documents of Philip Morris. Raising the legal minimum age for cigarette purchase to 21 could gut our key young adult market, 17 to 21, where we sell about 25 billion cigarettes, enjoy a 70% market share. Well, I certainly want to do that. I want to gut their market as much as I can. We know the smokers transition between the ages of 18 and 21 to regular use during this time. So this is a very important time to make an intervention to delay that onset of them picking up that first tobacco product. Nationally, 18 to 20-year-olds are twice as likely as 16 to 17-year-olds to be current smokers. Why raise the age? We know that nicotine is addictive, and adolescents and young adults are more susceptible because of the brain development in this critical period of growth. When I first started working on this issue just really a few years ago, we were approached a campaign about 15 years ago about it, and then approached again 10 years ago. And we've come back to this issue because there's been more science coming out, and that was certainly important to our organizations, as I'm sure it is to yours. But we found out more and more studies were being released, peer-reviewed studies, about the development in the young adult's brain. And we know this is a critical period of growth and development. And at that point, the Association of Pediatrics really became involved in this issue for that reason. The symptoms we know of dependency, withdrawal, and tolerance can occur just after a minimal exposure to nicotine. And if you talk to some of the youth, they will say, well, I was just going to have a cigarette on, school break was over and I was just going to have this one cigarette. Well, we know it doesn't take much to become addicted. As a result of the nicotine addiction, about 3 out of the 4 teens will become adult smokers, even if they intended only to have that 1 or 2 cigarettes and quit in a few years. The other reasons to raise the age is older kids are a source of cigarettes. We know that the retail violations rate is low. It's about 9.6%. Kids are getting their cigarettes from other sources. More than 18 or 19-year-olds in high school means younger kids have daily contact with students. So we look at this as, I just say, it's another tool in our toolkit to have an intervention where they don't have that opportunity to pick up that first tobacco product. 2/3 of the 10th grade students or nearly half of 8th grade students say it's easy to get cigarettes. They rely on their friends for their major suppliers for tobacco products. Tobacco companies target young adults. I'm not telling you anything that you don't already know, but no surprise, they have not stopped. Social media certainly is something that is out there, is being used. Point of sale, magazines, Rolling Stone, Sports Illustrated, with magazine ads. People magazine I picked up the other day, cigarette ads, and internships. So with the targeting is still there. The key messages that we want to make sure we use with raising the age to 21 goes back to the same thing. Tobacco kills. It kills more than 480,000 Americans each year. And to me, that's a mind-boggling number, but I always equate this is someone's mother, father, daughter, son, friend that's going through the chronic diseases that come along with this, and later the tobacco killing. So I think it's important to understand we're talking about one human being, and then it adds up to the 480,000 Americans each year. Since tobacco is so harmful, we should do everything we can to delay that onset of picking up that first tobacco product. As I mentioned before, you talk to the youth and they'll say, I'm just going to smoke it just for a little bit with my friends. The addiction is there, and it is worse for the younger brain, as I repeat. Tobacco companies target kids and young adults because they know that for most users begin to be addicted. We were very happy and glad the prestigious Institute of Medicine released their national report in 2015. This report gave us a lot of information and also gave a lot of credibility to this issue. We have done numerous polling across the East, West, Kansas, middle of the United States, and the numbers all come out the same. People want to see this policy move forward. We also know that, which is a word that's not used very much anymore, but it's a bipartisan issue. We're able to pick up legislators that have not been there for our trifecta issues, such as clean indoor air, or raising the tax, or funding of programs. But when it comes to the 21 issues, we don't pick them all up, but we do pick up some new partnerships. We also are able to build the capacity of the coalition by picking up groups such as March a Dime, groups that are concerned about pregnant women. You know, it depends on what state you're in, what groups you pick up, but the idea is to be able to keep the people very much involved with this issue as we move on to some other issue after 21. The data predicts substantial improvements in public health, but I think it's really important to understand these impacts are over a long run. I get a lot of states, municipalities, and cities asking, can you give me the immediate, what's it going to be? How much is the rejection going to be? Well, first of all, Hawaii just started doing their evaluation in January. New York should be coming out in fall, I understand, with some evaluation numbers. And we may not see a large impact, but what we're going to see over the long run is reduction of smoking rate by 12%, reduce smoking-related deaths by 10%. We want to delay that age, which I've said that over and over, until they pick up their, so they won't pick up and become a regular smoker. We also want to keep tobacco out of schools. And there's 18 and 19-year-olds in school. This is another intervention to be able to keep them from being the purveyor of the cigarettes to the younger 15 and 16-year-olds. We also want to simplify ID checks for retailers. We want to do what we all would like to do, reduce smoking and save lives. I want to thank TCLC for working with Campaign for Tobacco-Free Kids, and some other organizations have helped us with this. We realized with this particular policy, as we did with most emerging policies, there was issues that you pick up as you're moving along, as you're picking up working with cities or working with a state. We realized a lot of the laws that were on the books for smoking up to 18 were pretty archaic. And so some of those we needed to go back in and look at what we needed to change. And it could be a lot of different things, or rarely the laws were fine. But I advise everyone to go in there. The one thing we did find is enforcement needed to be looked at. You know, a law's fine, but if we don't have the enforcement piece with it, it's just the law that's on the book. So we have put together, as I say, with the help of other people, some of the things that we feel would be very necessary to look at as you're moving forward. We want to review the current laws to identify if there's any weaknesses, and if there is weaknesses, there are these things that we can change within the bill. We do not want to focus on the buyer of tobacco. In Hawaii, we had to go for a compromise, but one thing we wouldn't compromise on is if they made it a criminal offense. In Hawaii, it got to the Speaker of the House, the last step in the bill, and he wanted to have a very, I can't remember at the time how much, but he wanted to have punishment to the buyer. And after much meeting and deciding how to move forward, it was decided that there would be a punishment, but the punishment would be like community service or cessation, and it would not be criminal. We try not to have these punishments put in here. Communities of color, we have talked to them a lot, and they just would not be happy with the laws being in there because it's just something else that could be on the record, or it would be another position they would be with law enforcement. So there was a lot of adverse effects, and it was not something that the organizations working on this issue wanted to move forward. We want to designate an enforcement agency to work on 21 things, and so if you're forming a group, it's good to have if it's sheriff's department, if whatever law enforcement agency, have them at the table at the beginning. Don't call them up after the bill's getting ready to pass or has passed and say, hey, we need your help. In Hawaii, we had the law enforcement at the table. They even testified that they supported this law, and they certainly look at the enforcement piece as an important piece moving forward. You can put, this is a nice wish list. This doesn't mean everything would go in it, but require a specific number of enforcement checks. Consider the role of licensing. If that's something that you could get through, you have a state that does not have licensing, this may be a way that you can start moving towards that, which may mean that it has to be a couple years before you get to the 21, and maybe you could combine it together, but it just depends on the locality. You certainly want to require the appropriate signage, and you want to have retail education and make sure that that is taken care of, so you want to delay the start date of the policy. Military and tobacco prevention. This has really changed an enormous amount since I first started working on this. When I first started working on this, it was like, how are we ever going to get this to happen? The military is going to be probably not very favorable on this, and we will have a lot of people come out from groups such as the American Legion to testify. Well, surprisingly so, we have been working with not surprisingly, we've been working with the Department of Defense, but we have been working with the Department of Defense on our 6 Steps Day activities, and we also were working on them on what they were going to do to move forward with making sure the military is prepared in their readiness issues. They were concerned about the soldiers' health. They were also concerned about the cost of the tobacco use that had caused down the line, and they wanted to make sure that they were offering a number of cessation programs. They also wanted to know, what more they could do. So we were finding more and more the military was putting up ads and looking at ways to make sure their folks are combat ready. In 2013, the Department of Defense issued rules to expand smoking cessation coverage for military personnel, which was a big step, because if you recall, I'm sure you've all heard, they used to pass out cigarettes. On April 8, 2016, the Secretary of Defense, Ashton Carter, issued a memorandum updating tobacco control policies. Implementation plans for the new policies are expected to be in mid-June. So that's another thing. The memo will specify that tobacco use areas must be at least 50 feet away from the building entrances. It requires the price of tobacco products on base match prices in the surrounding community, and it defines e-cigarettes as a tobacco product, among other policies. I have to say that I was so excited to see how quickly that the military was able to move forward in some of the things they've done, because my experience has been it doesn't usually move really fast as a lot of big organizations. People have asked how Hawaii was able to get all the groups on board. It's because they knew before. They knew that this was coming down the pipe. The biggest reason was because they had the knowledge, they were able to not be hit with it as a surprise. The only issue that we had was that when it came time to release a press release, which military group was going to do it first? Was it going to be the Marines? Was it going to be, you know, the Army? That was something they had to handle amongst themselves, but we're very happy to say that they all agreed to move forward. The economy and retailers. You know, there's a little short-term effect on tobacco sale revenue, and the reason for that is the consumption by an 18 or 20-year-old is very small. They share, you know, in the state, for the total consumption in the state, it's a very small portion. The reductions in smoking initiative and smoking prevalence will be small initially, and then it will grow over time. As I back to the Institute of Health, it's a long-term impact it will have. The money that's spent on tobacco doesn't disappear. It stays within the community. It's just going to be used on other topics. And of course, again, we want to make sure we reduce tobacco health costs. And my slide's not moving. Just a minute. There it goes. Campaign for Tobacco-Free Kids has many resources on 21, and there's many more resources to come. We have the letters from the Department of Defense. We have, you know, particular letters that have been sent out in their newsletters about the cessation. We also have letters that are already set up that we have military people sign on to, or retired military people, that they supported 21 law in states. We have the total tobacco use. So the talking points, there's so many things that we have, and that doesn't mean we don't share. The idea of having all this information is having a place where you can come and be able to get the information. If we have fact sheets out there, you're certainly welcome to use them and put your logo on those. Just let me know. Don't change the fact sheet unless there's something you need to change. The other thing is, if there's something you need, and it might be cross-border sales, it may be a speaker, it may be a number of different things, I always say don't be afraid to ask. Just let me know. bmay@tobaccofreekids.org. Let me know, and our research department is very nimble. They're very good at sticking to what is scientifically based, and we're also very good at getting back to you right away if you need to move forward on these issues. And I'm excited, which I'm sure everyone's heard, but California, on May 4th, 2016, Governor Brown signed bills to raise the tobacco age to 21 for all tobacco products. The definition for e-cigarettes as tobacco products passed, so that was included in the Tobacco 21 law. And the 21 law exempts active duty military. That was not our idea to do that, but that was, you don't win all the battles. And Tobacco 21 goes into effect June the 9th, very soon. And we were very excited to see this law pass. So I am going to pass this over to Carrie Snyder now. And thank you.
Hi, thanks, Beverly. So this is Carrie. So now that we know how Tobacco 21 policies work and why they can be so effective, I'm going to segue into some things to consider when determining how to implement Tobacco 21 in your jurisdiction. They'll be familiar. Beverly hit on most of them. We'll delve into them in a little more detail here. So first, my disclaimer, I'm a lawyer, but I'm not your lawyer, so the information presented today is for informational purposes only. So today I'm going to first touch on some considerations about what you might include in your policy and then how you might effectively implement that policy. So first, you want to consider the scope of your policy, and we'll first talk about products. So an effective policy will cover all tobacco products rather than a subset of them, and this makes compliance and enforcement a lot easier. We know that electronic nicotine delivery systems are tobacco products. The courts have said so. The FDA is now regulating them as such, and many state and local governments have been doing it for a while. But there are some devices out there that claim to be nicotine-free, but you can't determine whether something's nicotine-free without testing it. Additionally, the sales and the use of these products have essentially the same effect on tobacco use normalization as nicotine-containing devices, precisely because you can't tell whether it contains nicotine or is nicotine-free. So an effective policy at the state or local level will therefore cover nicotine-free devices in addition to the nicotine devices. And this is for ease of compliance and enforcement. At the very least, a policy should put the onus on the retailer or the user to prove that it's truly nicotine-free. But the policy itself should broadly cover tobacco products. So what about cessation treatments and devices that contain nicotine? Well, a jurisdiction is likely going to want to exempt these, particularly if a new Tobacco 21 policy will affect 18 to 20-year-olds who are already addicted. In other words, those 18 to 20-year-olds are subject to the new policy. So they can't legally purchase tobacco products anymore, so you want to give them broad access to cessation treatments. So next, a jurisdiction should determine whether to implement a sales restriction or a purchase restriction. And by purchase restriction, that could be purchase or attempted purchase, possession, use. It's known by a couple of different ways in different jurisdictions, but I'm going to call them purchase restrictions. So the former places responsibility on the retailer, while the latter penalizes minors for purchasing or attempting to purchase the products. Now, purchase restrictions haven't been proven to be effective in reducing underage tobacco use. Additionally, the laws could divert focus from industry behavior and retailer compliance with tobacco control laws. So an effective policy will focus on tobacco industry behavior. We know from the 2012 Surgeon General's report that the tobacco industry marketing is a significant cause of youth initiation to tobacco use. The industry's business actually depends on youth initiating tobacco use and taking it up and becoming addicted very young. As you saw from May's slide, 95% of regular adult tobacco users are starting before they're 21. So implementing a policy restricting the sale of tobacco products to minors rather than the minors who have successfully been recruited will more effectively keep the focus where it should be. And if a jurisdiction already has a purchase restriction, Tobacco 21 can still be effectively implemented as a sales restriction. The jurisdiction might choose to make no change to the purchase restriction and leave it at 18 or wherever it is right now, but change the sales restriction to 21. Or it could choose to take the opportunity to focus on sales and get rid of those purchase restrictions. For example, I think it was Chicago that actually eliminated penalties for youth tobacco possession restrictions when it implemented its Tobacco 21 sales restriction recently. Exemptions to sales restrictions are often part of the discussion around Tobacco 21 policies. Specifically, what do we do with the 18 to 21-year-olds who are already addicted to nicotine? So a policy might include signage requirements at in the retail environment, directing tobacco users to cessation services. Alternatively, some jurisdictions have proposed exempting this group or a subgroup, such as military service members, but as May discussed, these exemptions don't really make sense from an enforcement or a public health perspective. So first, having different rules for different people is going to be very confusing, and it's going to make it harder for retailers to comply with the new sales restriction. Secondly, we often have different age requirements for different activities. You might be able to start driving at age 16. You can enter into a contract at age 18. You can't drink alcoholic beverages until you're 21. So, 18 isn't a magic number that's applied to everything. And while someone might be considered old enough to enlist in the military, for example, it doesn't follow that they're old enough or mature enough to take on a lifelong addiction. Moreover, the health consequences could hinder his or her ability to perform her military duties. As Beverly discussed, brain development is not complete. We know this until a person reaches his or her early to mid-20s, and younger people are more susceptible to the effects of nicotine, which can affect cognition. So while sometimes the political realities, cause us to discuss some of these exemptions from a public health perspective, it doesn't make sense to exempt any group from a Tobacco 21 sales restriction. Finally, a jurisdiction might consider whether to impose a restriction on the age of sales clerks permitted to sell tobacco. Requiring clerks to be 21 or older can limit opportunities for social sources of tobacco for the friends who come into the store, but it also might limit employment opportunities for small retailers and for teens in rural areas. So that's something that should be considered thoughtfully. In all cases, an exemption should be made for use participating with parents' permission in compliance checks. Compliance checks are vital to enforcing sales restrictions, and any Tobacco 21 policy should include that. So in sum, a jurisdiction contemplating Tobacco 21 should develop a thoughtful policy and not rush into it. You should consider the scope of the policy and the procedure through which the policy will be enforced and compliance monitored, because without enforcement, these policies are not going to be effective. So once we've identified the scope of the policy, we need to consider how best to implement it. To do so, we should consider the existing legal landscape and work within it or change it as necessary to make sure that our policy is going to be effective. It's imperative that compliance is monitored regularly, and enforcement must include meaningful penalties that will ensure high compliance rates. So first, we'll talk about tobacco retail licensing. The Institute of Medicine concluded that a Tobacco 21 policy will be most effective if it's part of a more comprehensive tobacco control program. And tobacco retail licensing can be a significant part of a comprehensive policy. It can be self-funded when fees are set at a level adequate to pay for the administration and enforcement of the program. The suspension or revocation of a license is an effective enforcement mechanism, more so than fines, which can be written off as a cost of doing business. And licensing is well established as a legally enforceable business regulation, allowing jurisdictions to identify who is selling, where they're selling, and what they're selling. Compliance checks should be built in as well. In particular, the decoy purchases using youth should be used at regular intervals. And these are easier with a licensing system because we know who all the retailers are if they're required to have a license to sell tobacco products. The policy should clearly identify the enforcement agency who's going to administer the licensing system. If there are multiple agencies involved, a lead enforcement agency should be identified. And licenses should require a fee, and that fee should be set at a level that's adequate to fund the setup, the administration, and the enforcement of the license conditions, and the requirements, including any Tobacco 21 policies that are incorporated therein. And finally, licenses should cover vape shops when ENDS sales are restricted through the policy. So vape shops might not be included in an existing tobacco retail license requirements. They've popped up really quickly in many jurisdictions, and some of those jurisdictions haven't been able to keep up and they don't know where they are or exactly what they're selling. So we recommend that vape shops are also included if the Tobacco 21 policy is covering ends as it should. So an example of using retail licensing to enforce the Tobacco 21 policy is New York City. New York City requires cigarette and ends retailers to register with the city. And while the Tobacco 21 policy applies to all tobacco products, including those for which no registration is required, enforcement is still tied to that registration. So a retailer who sells smokeless tobacco to a minor is subject to the loss of his cigarette license, even though the sale didn't involve cigarettes. And that can be very effective. When you take away the actual ability to sell that product, it can be much more effective than simply imposing a fine. So next is what I refer to as a standalone policy. And by this, I simply mean it's not tied to a licensing system. It might be part of a comprehensive tobacco control program, and in fact will be more effective if it is included in such a program. But the penalties, for example, might consist of fines only, perhaps some retailer training, that sort of thing. As I stated earlier, fines can be written off as a cost of doing business, particularly if they're not set at a high enough level to impact business income. So with any standalone policy, a jurisdiction is going to want to consider to make sure the penalties are meaningful, make sure they're going to make an impact, and that businesses are going to pay attention. You want to incorporate meaningful compliance checks, again, those decoy purchases, and set a regular interval, a certain number of checks per year, for example. You want to incorporate some mechanism through which all tobacco retailers are identified for those compliance checks. So if you don't have a license, there should be some other way to identify who needs to be checked. And finally, you need to ensure a stable funding source for enforcement. You need adequate funding for staff, for training of that staff, for training of any minors who are involved in compliance checks, retailer education, et cetera. So an example of this would be Hawaii. So Hawaii does have a permitting requirement for retailers, but the Tobacco 21 policy specifically identifies fines that are imposed for violations of the sales restriction. So finally, some jurisdictions have used the regulatory power granted to administrative agencies, such as boards or departments of health, to implement Tobacco 21 policies. And this can be a benefit because the procedure through which rules and regulations are adopted can often be accomplished faster than that for the adoption of laws through the legislature. But an administrative agency is generally part of the executive branch of government, if you can remember back to your civics classes. So it's important to take a look at the scope of the authority that's actually granted to the agency through legislation. So generally speaking, an executive agency is charged with carrying out laws that have been enacted by the legislative branch. And importantly, this authority does not include creating new law, but it can include rulemaking authority designed to sort of fill in the details of a broad legislative policy. And each jurisdiction is going to be different, so it's important to really take a look at the extent of the authority where you're working. For example, in Massachusetts, Tobacco 21 policies and other tobacco control policies have been implemented through boards of health in many jurisdictions because they have broad public health rulemaking authority. By contrast, in New York State, the courts have narrowly interpreted the authority that's granted to local departments and boards of health, and efforts to implement innovative public health regulations have been stymied in recent years. So it's very specific to the jurisdiction within which you're working, so you want to take a look at that. So in sum, a jurisdiction looking to complement its existing tobacco control program with a Tobacco 21 policy needs to carefully consider what the scope of the policy is going to be. Is it going to be a sales or a purchase restriction? Are there going to be exemptions? What products are going to be included, et cetera? It should identify who will enforce the policy, so that it's clear to everybody who's going to be doing the compliance checks and who's going to be responsible for that. And then how will the policy be funded and enforced? It should include meaningful compliance checks and penalties for violations and a dedicated funding source to make sure that those can happen in a meaningful way. So we have lots of resources on our website if you want to take a look at that. We primarily work with New York State, but our resources are available for anybody to use. And with that, I will turn it over to Scott. Thank you very much.
Thank you, Carrie. We have a better idea now of the why these laws are important, the how, be it what type of policy language or policy options do we have, or how do we navigate the policy process at the state or local level, and implementation and enforcement, those concerns and considerations. But what else does someone need to think about or worry about if they are getting on the front end of a Tobacco 21 initiative? We'll walk through, with the next 10 minutes or so, some of those other considerations that can come up, two considerations in particular. We'll reiterate some of the things that Beverly and Carrie have already talked about, but move on from there. Okay. Whenever we're talking about or working on a public health initiative, be it tobacco or otherwise, authority is always a consideration. Someone has to have the power to do what they want to do. They want to adopt a law that addresses whatever it might be. They got to have the power to do it. And that's because it's not always the case. People, cities, counties, they don't always have that power. Most, if not all of us on the webinar today have heard the term preemption raised before. Preemption, it's like the four-letter word in tobacco control. Well, I guess if you count it up, it's like two four-letter words and a big exclamation point. Something that if you would have used it similar when you were a kid, you would have got your mouth washed out with soap. Now, preemption occurs when a higher level of government, it eliminates or reduces the authority or the ability of a lower level of government to do something concerning a particular subject or a particular area. Now, when we talk about Tobacco 21 laws, the federal government or federal law doesn't preempt states or localities from adopting a law. So when we talk about preemption, we are talking about whether or not state law or the states preempt local action. Now, this preemption, unfortunately, it's really the rule of the land or the law of the land. Local governments are considered creatures of their states, ones that have limited authority. The only authority that they're supposed to have is the authority that's given to them by, their state constitution or state law passed by the state legislature, signed by the governor. And because they're creatures of the state and because they have limited authority, any disputes involving or associated with their authority has to be resolved against them. And there's a reason for this, unfortunately. Think about what America was when the Constitution was being written. It was rural, it was agrarian, there was a low population, there were very few cities. The ones that existed were small. Philadelphia was probably really the only city that would mirror what you'd find in Europe. And so local power, or cities and counties using too much power, too much authority, it wasn't a concern that had to be addressed specifically through the Constitution. Well, then what happened? And the Industrial Revolution happened, and people moved away from their farms, and they moved into cities, and when people live in close proximity to one another or work close to where they live, there's impact, and there's more need for cities, for counties, for villages, whatever the local government's called, to act, and to have the authority to act in everyone's collective best interest. If the Constitution was written today, the society that we have in the cities and the urban areas, I think this would be a different story, and we probably would see some recognition of local governments within that body. But the whole idea is local government, again, or local power can be limited. Sometimes it's limited specifically, sometimes it's limited directly. When we have something like this, it's called express preemption. This law specifically prohibits political subdivisions in that state from adopting or enforcing additional laws related to retail licensing. Sometimes it's more implied. Somewhere sitting on the surface. Nothing specifically says a city can't do this, but there's a pretty detailed state law that seems to be very comprehensive, doesn't seem to leave much room for an alternative approach. Or perhaps the county licenses. And since this law is going to be related to licensing, well, then maybe cities, they don't have the ability to do that. Sometimes, again, this preemption, it's expressed and sometimes it's implied. So what do you want when you're working on this? And the question is, can we do this? Well, ideally, you have something that empowers the entity that you're working with, the city, the county, the village, whatever it might be. Something that specifically says they have the ability to act. They have the ability to adopt more stringent regulations concerning clean air laws or youth access or licensing. That's the ideal. That's the optimal. Next best is something that, well, it doesn't preempt you specifically, again, from going farther. Something at the end of a bill or at the end of a law that does, if you have the ability, if you have the power, you can go farther. And you can add on to what the state law might provide or what a county law or whatever else it might be. Cities and counties, sometimes we hear the terms again, are you a Dillon's rule state or are you a home rule state? Well, really, all, at its essence, all or most states, they have a combination of both. And to deal with some of those issues that we talked about before that pop up with people living and working in closer proximity, cities and counties and other local jurisdictions have been given some general or blanket power to deal with the health, the safety, the order, the general welfare of their community. So long as it's not inconsistent or so long as it's not preempted by another law, we can act. So quite often when we are dealing with tobacco control laws, we are dealing with some law, or we're dealing with the authority like this to deal with that law. So the first thing you have to deal with when you're thinking about tobacco 21 laws and what we might like to do, can we do anything at all? Do we have the authority? Are we preempted? Can we make an argument that we do have the ability to act? And the other thing that can come up with these laws is concerns over equal protection. And Beverly talked about this during her presentation. I believe Carrie did as well. How do you treat someone who is otherwise an adult, take away their quote-unquote rights, their ability to do something, to treat them differently than other adults in similar situations would be? Well, there are laws that treat adults differently, that set different ages to do something. Courts are generally deferential to age laws, so long as there is a relationship between the law and the interest or the harm that the government is trying to get at, to prevent, to restrict by adopting this law, and the impact on youth use and initiation and the health benefits from pushing initiation back, be it 3 years, can be the justification for that, the fair and logical reason for that law. As both Beverly and Carrie talked about, the ability to enforce and knowing what the appropriate consequence for violations are critical with these laws. Laws are generally enforced one of two different ways. There are inspections, the inspection-based enforcement, where we go out and we directly investigate to see whether violations are happening. Sometimes it's complaint-based, where we wait as the government until someone calls us and says something's going wrong, act, fix that. and through licensing systems and dedicated inspection programs, there's the ability to actively enforce these laws and make sure that they are being complied with. And when they are not being complied with, what is the appropriate consequence for your jurisdiction? There are lots of options, from training to community service to some type of administrative fine to license revocations and suspensions. What works for you? What authority do you have to do that? Again, what is the scope of your regulation? And are there any possible limitations to that? Is there any preemption dealing with tobacco products, the way that that term is defined under state law? But do you have the opportunity to go farther in terms of ends or e-cigarettes or things like that? If you do have laws that deal with the purchase, the attempted purchase, the use, or the possession by minors, how will that fit in when, if the focus is on the retailer and that sale? Things to consider on the front end. And are there any, using the broad term, exemptions that should be part of your regulation as well? If you're building into an existing licensing law, it might already be there, but if this is a standalone law, as Carrie talked about, one of the options, do you need to have a little bit more detail to cover some of these things? Cessation products, devices, products approved by the FDA for cessation purposes, specific exemption for that. Potentially participants that are used by the city or the county or the state for compliance checks. Specific language, specific exemption for them so that if the law deals with their possession as well, to provide some coverage for them. Or potentially employees. State child labor laws are generally silent, so there's a lot of licensing laws are silent on this as well, but specific content that says if employees are under 21, it's not a violation for them to handle tobacco as well. Grandfathering the underage is something that is brought up as a possible consideration. It's not one that's favored, but as part of the policy process, it might be discussed. Consider the other options that are related to age to sell or age to purchase. Minimum clerk age. Some of the peer pressure associated with selling to one's peers, their high school peers, can be quite difficult to fight. And if the age to purchase is raised to 21, some consideration of raising the age to sell or even establishing an age. In many states, a minimum clerk age to sell tobacco isn't established. That's something to consider. As well as lots of other things, from samples to sampling, advertising, minimum price laws, flavors, perhaps increased penalties from what is provided in state law, discounting. This tobacco 21, raising the age to sell, is one in a menu of possible things. And if you have lots of momentum around tobacco 21, it's something that people are on board about. Other communities have done it, and your community wants to do it as well. Sometimes it's best to move slowly. Not too slow that you lose all your momentum, but take a little bit of a pause to make sure that the regulation that is adopted is as comprehensive, as enforceable, as defensible as it is, so that the benefits that we have will be as far and as wide as possible. Before we go to questions, there's a couple things to mention. Today's is one in a series of webinars that the consortium provides. I believe we are going to have one in June, at the end of June, but we do have this one already in July already set. News from the front: state and local regulation of e-cigarettes, legislation and advocacy. This consortium webinar will examine the current political landscape of state and local regulation of e-cigarettes in the United States and discuss regulatory gaps in wake of the FDA deeming rule. An advocacy leader for the American Cancer Society and two legal experts from the consortium will identify recent trends and emerging issues both nationally and what we've seen in Minnesota. For more information, please go to our website. And on our website, we also have some resources related to T21 laws, a sample resolution that a locality can adopt asking its state to act a sample ordinance, and as well as a tips and tools fact sheet discussing a lot of things we talked about today, raising the minimum legal sales age for tobacco and tobacco-related products. With that, we will move to our questions. We have received some, but if you have a question, please enter it into the chat box. First question we received is, do you have any good examples of floor preemption laws that define more stringent for the purpose of giving local governments authority to enact public health laws stronger than state or federal law? Carrie, do you have an example that you would encourage our audience to look at?
I do not.
Okay. Well, in Minnesota here, we don't, our tobacco control laws, they're not empowering. They, be it for clean air laws, for licensing, or for youth access, 3 different areas in our state statutes. But they do have savings clauses within them, and they do provide that so long as there isn't any preemption or control, our localities can act farther. And so that's why, if you're looking for an example of these savings clauses that really sets the state law as the floor to build off of, Minnesota's is a good one, assuming that the localities in the state that you're working in do have general police powers, general welfare powers that they can use as the basis of that. Another question that we're receiving, I think this is a good one for Beverly. Are there particular, when working on Tobacco 21 laws, are there particular things that decision makers or legislatures have found particularly compelling, or things that they do not find so compelling about raising the age?
That's a good question. It's kind of a, as we're moving forward, the more education we do on this topic, and I think there's one thing that is really important, the media loves Tobacco 21. And surprisingly enough, most of the stories are accurate, excuse me, and very positive. So as we move along, the education on this issue is coming out in a lot of earned media. So things that we started out with having to talk with legislators about, you just don't change the age from 18 to 21 on a document and that makes everything okay, which was kind of the feeling a lot of legislators had. You talk about more about the education, and I find that the issue of brain development and talking about that and having a physician, preferably a pediatrician, talk about that issue is quite compelling to legislative bodies. You're always going to have the naysayers and you're going to have the folks that don't want to listen, but there have been people on the fence that have heard that testimony and have seen that it's science-based, and they have moved over to the side of 21. And to the point that it preempted any questions they had about taking rights away from the military. So I think it's always important to make sure you give a little bit of everything, not make it look like a Christmas tree, but make sure you educate in a way that you talk very positive about what the military has done and try to preempt any of the questions they might have. And I'm sure as we move along with this, we'll find more and more issues that hopefully we can educate beforehand and not have to fight when we get down to the policy.
Another question that we received is, were there any benefits to businesses through raising the age? Perhaps, as one example, you might have the same age for alcohol and tobacco sales. What types of benefits are there to this?
This is Beverly, and I will answer it this way. I know in a couple of the states that we were working in, they wanted to make sure it kind of came back, reminding me again of the smoke-free laws. The retailers came back and said they would rather have a level playing field than, you know, some stores able to sell to younger age than others. So, you know, you're going to get that. But then again, we had the Korean Grocers Organization that was funded by the tobacco industry that testified in California. So, you know, I think the biggest thing is to say your money's not going to disappear. You know, the money doesn't go away. The other thing in Hawaii is that we had the convenience stores, you know, we had communicated with them, and usually that was through the council person that communicated with them. We didn't know the coalition. So there was still communication going on. So I'm finding, not that they're all willing to jump on board, but I wouldn't be surprised if it won't be like restaurants used to be, where they wanted a level playing field than just certain restaurants were smoke-free.
Thank you. Another question that came in, start with Carrie on this one. Can FDA-issued warning letters, civil monetary penalties that are assessed to identified local retailers, can that money be used to issue a local citation against the same retailer if the city has a Tobacco 21 ordinance in place?
I'm not sure off the top of my head where that money goes to do that. I want to say no, but I'm not positive. I'd have to go back and take a look at where FDA dedicates that money.
Yeah, and I think one of the, perhaps a related issue to that would be the FDA inspection. It's done for enforcement of federal law, which will be broadened out with the deemed rule. But if a local jurisdiction has a broader law itself or a broader state, I don't believe the FDA inspectors are generally going in looking to see compliance with the state or the local law as well. Another question. How has youth support had, or excuse me, has youth support had any effect on the success in passing this type of law? Beverly?
Oh, yes. It's been very effective from the Big Island to the whole state of Hawaii, also in California, and in small municipalities. You know, it sounds kind of silly in a way, but 21 Reasons was a name that was kind of pulled out of the air as a campaign, and we had T-shirts printed up where the arrows were pointing forward, talking, "You're protecting me," and, you know, the quotes from Philip Morris on the back, and all the same colors in Hawaii. Extremely effective, extremely effective. Afterwards, we talked to legislators to say, what was some of the reasons that moved you forward? And they talked about the youth talking about that they could easily purvey cigarettes from older students. And so, yes, it has been effective. I will have a caveat to that. I know there's some states that I don't want to say they dislike youth, but they would prefer not to have youth come around. So you have to make sure you know your audience and the landscape of the legislature.
Thank you. A question, another question that's came in. Can we or should we raise the age to purchase pipes, rolling papers, and other paraphernalia? What do you think, Carrie?
I would say yes. I know in New York we treat the smoking paraphernalia to the same sales restrictions as we do the tobacco itself. Those products are, generally marketed for tobacco use. There's no reason that youth should be able to access those if they can't use the tobacco.
Okay. Another question for Beverly. Has there been any media campaigns for Tobacco 21 ordinance?
Media campaigns, no, but we certainly have had a lot of earned media. And we've also made sure that we have had press conferences, whether there's one state right now that because of preemption, it can only go by the state, and they're collecting resolutions from cities saying that they would support this. Along with that will be, signatures of people that want to support this. So there would be a large press conference. We've done polling to make sure that the earned media, one example was in Washington State, we did a poll. There was one in Hawaii also, and that poll number was used throughout the whole legislative session. We've set up microsites then to go along with when we do the polling and make sure we get that URL out there so people can respond in different ways. So as far as media campaigns, as far as TV, radio, no. We've done a lot more on social media and also earned media that's been very effective.
Another question that came in. I live in a state where it is currently illegal for those who are underage, presently 18, to purchase, attempt to purchase, use, or possess. If the law is changed to make it illegal to sell or furnish tobacco to those under 18, won't those who are 18, 19, or 20 who are using tobacco be treated as though this is acceptable? Well, the answer is it would. It's if the age restriction or if the increased age restriction is specific to the retailer or the retailer's sale, or I guess anyone else who might distribute a product to someone, if that is the only action that is regulated and the age to use or possess remains at 18, someone who is 18 would be able to continue to use or possess. It would create different ages for different actions. Another question that came in for Carrie, compliance costs money. How do we pay for it?
Well, I'm again going to make a plug for retail licensing, where you can do that. Those license fees are intended to support the administration and the enforcement, which includes compliance checks to make sure that retailers are complying with the law. Certain jurisdictions may have taxing authority and could impose taxes that could be used for it. But there does need to be an identified source of continuous funding so that enforcement can take place. Without the enforcement, these policies are not going to be effective in reducing tobacco use.
Another question probably appropriate for everyone on the panel today. Are there any non-health impacts that a local jurisdiction should be prepared to respond to when working on Tobacco 21 law?
Could you repeat the question, please? I'm sorry, I didn't get the first part.
Are there any non-health impacts that a local jurisdiction should be prepared to respond to? I think perhaps one would be if local retailers brought a concern about what this will do financially to their businesses.
Right.
Being prepared to share the information of the percentage of business that is 18 to 21-year-olds, and someone else please correct me, I think it might be 3 to 4% or something like that, that there might not be an impact, or someone might wonder, well, how many gas stations or convenience stores are closing because of that? I mean, I think some of that is maybe the financial concerns that could be brought up, particularly in a rural or a jurisdiction that's not growing, and every business that they have, even if it's a corner gas station or a convenience store, they don't want to lose anyone, and they might be particularly mindful of any regulation, or excuse me, any impact that might be on business. Perhaps that's one. Is there other non-health considerations?
Yeah, I think that's a very good one, and I will say Campaign for Tobacco-Free Kids has a full page of arguments, against the economic arguments and the other issues that may possibly come up if it's military or if it's the economic issues. Frank Chalupa did a report about a year ago that, talked about the retail, but again, the money doesn't go away. It stays there. It's spent on other items. And I think that's extremely important. I think the military also will be someone non-health, but, you're going to get some of the comments, and I think more and more we have evidence and we have rebuttals for those military arguments.
Carrie, do you have anything additional to share?
No, those are the two main issues that tend to come up when we talk about Tobacco 21. There's one non-health benefit to compliance. In certain states, there is a different driver's license for those who are under 21 versus those who are over 21. One's horizontal and one is vertical. So it does, can make it easier for a quick identification of people who are 21 or older.
Okay, I think we have time for one more question. If you had a question and we weren't able to get to it, please, if you want to connect with us, we'll certainly respond offline. And we'll start again with maybe Beverly on this one, though. Anyone? Can you give a specific example of a success story, one that you're particularly, I guess that jurisdiction should be particularly proud of?
Yeah, I'll go back to, yes, and every time I tell this story, not to be sappy, but I get tears in my eyes because it was always kind of unexpected. On the Big Island, Hawaii, we started out there because we knew there was a lot of military bases in the state of Hawaii, but on the Big Island, there wasn't military bases. But the chair of the coalition there, her husband was very active, he was active in the National Guard, and he had some kind of high position. And she was very upset, along with other National Guard wives, that the councilman would even think for a nanosecond that they were, husbands were going away so they could learn how to smoke cigarettes, and that's what they cared about, and they blamed other military people for wanting to smoke and using this fight. So basically, they testified and said, our husbands love America, and they're doing this because they want to do what they're asked to do for this. They're not going out to start smoking, and that's not why most military join. And it was authentic, it was real, it was one of those times where we didn't have talking points, it just happened, and it was very moving.
Great, thank you. Again, there was a lot of questions, probably a few more than we have the time to answer, so we apologize for that, but please, if you follow up, we will get back to you. Again, plug for another webinar in our series, News from the Front, State and Local Regulation of E-Cigarettes, Legislation and Advocacy. That will be Tuesday, July 26th at 12 o'clock Central, though I do believe we're going to be having one in June as well. Stay tuned for information. By all means, one of the takeaways beyond the information we provided in the presentation is that you do have resources available from the campaign to us at the consortium to the center in Boston. And so please, whenever you have questions, reach out. A recording of this webinar will be available soon. We are applying for continuing legal education credits in Minnesota. If you need potentially assistance with that somewhere else, please let us know that as well. On behalf of everyone, I want to thank you for logging in. Have a great Tuesday. Goodbye.